Say you go to the doctor for a cough that just won't clear up. Your doctor gives you an exam, does a chest X-ray and diagnoses you with walking pneumonia. He writes you a prescription for antibiotics and tells you to get some rest. You take the antibiotics and spend weeks on the couch re-watching every season of your favorite series. But you still aren't feeling better. So, you go see your doctor again. This time he looks more concerned. He sends you for a CT scan. The diagnosis? Lung cancer. Before we continue, remember to leave me a like and subscribe to the channel. If you are already a subscriber, then thank you for your support. Lung cancer is a very treatable disease if you catch it early. But those weeks you spent binge watching your TV shows, your cancer was spreading. And now your odds of surviving are lower. Talk about a nightmare. But it's more than a nightmare for hundreds of thousands of people around the world. In fact, diagnostic errors are one of the most common and serious medical mistakes. So many people die or are permanently disabled because of them. The question is, how do you prevent a nightmare like this from becoming your reality? Well, it's helpful to know which conditions are most likely to be misdiagnosed in the first place. And lucky for you, a new study just revealed the top 3. Researchers from Johns Hopkins Armstrong Institute for Patient Safety and Quality just figured out the 3 disease categories that are most likely to be misdiagnosed: vascular events, infections and cancers. They did a thorough analysis of 11,592 malpractice insurance claims and found that these 3 types of disorders make up 3/4 of all misdiagnoses that lead to death or permanent disability. More specifically, they found that 8% of serious misdiagnoses were cancer. 8% of serious misdiagnoses were vascular events and 5% of serious misdiagnoses were infections. If you'd like to know even more precisely what conditions to look out for, researchers identified the most misdiagnosed condition in each of these 3 categories. The most misdiagnosed cancer is lung cancer, the most misdiagnosed vascular event is stroke, and the most misdiagnosed infection is sepsis. Besides the big 3 mentioned earlier, several other conditions were likely to be misdiagnosed and lead to death or disability. They include heart attack, venous thromboembolism or blood clots in the legs and lungs, a rupture of the aorta, arterial thromboembolism or a blockage of the blood supply to internal organs, meningitis, pneumonia, spinal infection, breast, colorectal, prostate and skin cancers. How can you use this information to decrease your odds of becoming one of the people a misdiagnosis harms? Well, I'd start by paying close attention to the big 3: lung cancer, stroke and sepsis. If you ever develop symptoms that correspond with these diseases, don't be shy about asking your doctor whether he or she has ruled these serious conditions out. And if you have a gut feeling that your doctor's diagnosis is wrong, seek out a second opinion. It's your life on the line, after all. So that's the video, and hopefully you have learned a thing or two. Please don't forget to leave me a like, share the video with your friends and subscribe. See you next time.